Hey, it's Pete from, I guess it's still 21st Century Prepper podcast. We're here tonight with an update on the coronavirus or COVID-19, whatever it's been called today, SARS, COVID-19, whatever. It was a month ago. Yeah, it was actually 30 days ago that we did the last podcast. So it was the 2nd of February. And little changes. A lot more deaths in China, obviously, and now we're having deaths in the U.S. and other countries. I'm looking right now at the coronavirus COVID-19 global cases by Johns Hopkins CSSE. It's at, if anybody wants this, it's GISANDDATA, so gisindata.maps.arcgis.com. I don't know if I can put that in. Maybe I'll put it in a comment on the Podbean page.
And YouTube as well. Yeah, we could probably list it on YouTube and on...
Yeah, if I ever get it on YouTube. I haven't done the first one yet. It's a global tracker. It's tracking. It's been, almost since day one that it's been, making news around the world. It's tracking all the cases, confirmed cases in other countries and in China. Right now, I'm looking at the U.S. It says 124 confirmed cases. Now, keep in mind too. What's the number that came in from China? What are they saying? That is about 47. I think I heard last.
Yeah, something.
It might be more because some of those people have been confirmed now. But those were a lot of people that were in China that probably got it there, and then they brought them back, and also that cruise ship that was off of Japan. So
I think
now what you said, there has been 6 confirmed deaths.
There's as
9.
As of 6 p.m. What is today? 3/2020. As of 6 p.m. East Coast time, there was 9 deaths in the United States, all of which are in Washington State.
Okay, and I'd seen yesterday that at least three of those were at a retirement home.
I believe so. Yeah.
So you're talking older individuals, which they've been saying that this kind of targets older individuals. So, disclaimer again, we had it with the first podcast. Neither of us. I didn't even introduce you. Skip's here with me. Right. We just jumped right into it. Neither of us is medical person, medically trained, other than first aid. I've come straight forward to that. I have no medical training whatsoever. We're just kind of reporting what we're reading and kind of common sense stuff.
Yeah, I'll throw it out there that we have vetted all of our news. None of this is fake news. This is all confirmed, factual information that we're passing on to you all. There's no hearsay, and we didn't get this off of, Bob's coronavirus page. So, yeah,
I've been posting on Facebook groups the CDC guidelines and all that stuff, and all I get is blowback from that. It's amazing that the people that deal with infectious diseases, people don't want to listen to them because for whatever reason. We'll get into that in maybe the next podcast if we have time to do that tonight. My rant about what's wrong with preppers. But follow the CDC guidelines. Go to CDC. I believe is it .org? I can't even remember.
I think
right
it is
now.
.org. Yeah.
Check that out. Also, the World Health Organization has a website. Check that out. Your state's health department is going to be ramping this stuff up
very quickly.
I've seen stuff from counties were sent out. I've received a couple of emails, copies of emails sent from school districts home to their parents of the kids. And they also tell you to contact. They're in contact with the state. They're in contact with the federal government, federal level, and all that kind of stuff. So. Don't be afraid of what the feds are telling you. They're not trying to kill us. We'll get.
Yeah, that's another podcast.
Not chemtrails. Okay.
I've got
So,
quite a few talking points here also, Pete, that
Yeah.
just real quick if you want to go over them of confirmed stuff.
go ahead.
The World Health Organization has said that 3.4% of those diagnosed that are confirmed have indeed died. Generally, I have not gone off of China's numbers because, let's be honest, it's China. Right now, South Korea is 5,000 confirmed cases. South Korea right now is the country to watch because they're going to be straight up forward with their reporting on this and their diagnosing.
Yeah.
70,
Very modern.
very modern,
very up to date. We have
semi-Western culture. You know, it's
yeah.
So
we have our military personnel there. Yeah, we're watching those numbers.
we have 70 countries confirmed in this world that are now reporting cases of coronavirus, confirmed cases. I don't have the death rate by country. I just know that it is 70 countries. And it might actually be 71 now. Like I said, this was all confirmed as of 6 p.m. on 3/3, and it's now actually 10:30, so that might have changed a little bit. North Carolina and Georgia are both confirmed new cases. The North Carolina case, I believe, stems back to the Washington State nursing home. So that shows you how quick that shit can fly across the country. You know what I mean?
Yep. Yeah, it seems to be. It looks like in Raleigh.
Yeah.
That's where this person is. So, and what was the other state you said?
Georgia.
Georgia. I'm not seeing one in Georgia.
It was last night. It was broke.
Okay. See, and I'm looking at the map right now.
Gotcha.
On the Johns Hopkins
Okay.
thing that I mentioned earlier. Right here it has, and this includes China numbers, and everybody pretty much is, says China is lying about the numbers across the board. Everybody.
Everybody.
Or, maybe not officially saying China is lying because that's diplomatic stuff, but total number in the world is 93,000 confirmed cases.
Confirmed. Yeah.
80,000 plus in China, over 5,300 in South Korea, 2,500 in Italy, which is amazing.
Yeah, that's taken off too. But like I said, I'm paying attention to South Korea. That is the closest that we have to the United States outside of the United States right now. That's got a large mass infection. So that's very interesting.
And 2,300 in Iran.
Right.
But
I saw that the advisor to the whatever it's called over there keeled from it also.
They bought it already. I'd heard they had it.
That's what I heard last night. I didn't confirm
the
that.
Department,
something like that.
Iranian Health Department official.
Some advisor. I did find out tonight that the United Kingdom has followed suit with Japan, and they have closed schools for a month. That is really big.
Yeah.
And something that I expect to possibly see here happen in the United States if this really does take off.
Yeah, and everybody who's listening, you got to understand, South Korea is at 5,300 people already, and the U.S. is at 124. Japan is sitting at 293. But remember, also, and I've said this dozens of times now, we're not China, we're not South Korea. Their cities are pretty jam packed.
We are, but we're also different in a way. And the thing that gets us, and I just did this. I went to Dunkin' Donuts. I got a cup of coffee. You know how many people have been in there and hacked on that, and it's crazy. So that it actually could, in some ways, explode here faster. The mail system and our monetary system.
True, that's true. And there was a postal employee in Seattle that was diagnosed.
And on that note,
Monday.
And on that note, we have an Amazon employee that was tested positive in Seattle. So that's huge. I mean, think of how many Amazon boxes you see sitting on steps going down the road.
Mm-hmm. Yeah. Well, hopefully they're not someone who touches all the boxes.
Oh, that would suck.
Hopefully it's someone in the office.
Yeah, and a postal employee, it depends on where they are in a post office, but if they're a sorter, I mean, good God, they could touch 100,000 pieces of mail in a day, you know what I mean?
Yeah.
So that could be bad. Which brings up Pete's point from the last time, wash your damn hands.
Yeah. Yeah, it's, and we'll get into it, but yeah, it's simple hygiene is the biggest thing you could do.
My other half read on the, I think it was the World Health Organization or the CDC, that on average, a person touches their face 200 times an hour. Well, think about that.
That seems an awful lot, but yeah, I could see it. Yeah, your hair gets in your face, your eye itches, your nose itches.
Exactly.
I'm doing it right now. And you talk about something itching, and then it itches. But yeah, it comes down to the biggest thing you can do to guard against getting anything, flu or the cold, or let alone this virus, is proper hygiene. Wash your hands, wash your workstation at work, wipe down your car steering wheel.
Don't
use
touch,
if you go to the bathroom, public restroom, use a towel to open up the door, because you never know.
And turn off the water.
The 400 people in front of you wash their hands, because they probably didn't. So that's the biggest thing. I've been catching a lot of flack because, like I said before, I follow the CDC guidelines, and CDC guidelines say healthy people do not have to wear masks for multiple reasons. One thing, they have to be fitted properly. I recently traveled. I was down in Charleston, South Carolina for a week, and when we went there almost a week and a half ago, I saw one person wearing a mask, and that was in the Minneapolis airport, and it was a woman. She was probably 7 or 8 months pregnant. I'll give her that. Okay, just from everyday germs and the flu and whatever, I'll give her that one. Coming back a week later, just this past Saturday, I bet I saw 40 people wearing masks. So it is getting out. Then, obviously people are hearing all the stuff. The president had his press conference a couple of days before that and all that. So,
well, that brings up the panic buying. I mean, we've seen that firsthand.
Oh yeah.
Here, I live in rural Eastern Shore of Maryland, which is chicken country, and my Walmart looked like there was a hurricane coming.
I haven't been to one yet. I didn't go. I was going to go shopping last night, but I didn't. We're going this weekend. So.
Well, it was literally just like a hurricane. Bottled water, milk, eggs. Of course, we did go in to clean an aisle. Bleach was depleted, but it wasn't out. Toilet paper, all the cheaper brands were gone. Disinfecting stuff like Lysol, that was non-existent. It was just wiped out. I didn't go to meds or anything like that. But I didn't expect that because of where I live.
Yeah.
That's a huge Walmart. It's one of their biggest stores in the state, and it feeds the smallest area. So I would be very interested to find out, and people can comment on our Facebook page, what they're seeing in their Walmart and more metro areas, because I really didn't honestly expect that. When the bottled water was cleaned out too. It's like, this is a big store. This isn't like your little, satellite Walmart. This is a big store that probably only feeds, God, I don't even know the population of this county, but it's small,
Mm-hmm.
So that was rather interesting that the panic buying was like that. Everybody was off for the weekend, and I'm sure Joe Blow said to his wife, hey, let's grab an extra bottle of water and some disinfecting while we're out. But everybody did that.
Back to the mask thing.
Oh, yeah, I'm sorry.
The CDC recommends you do not wear a mask if you're healthy. Now, obviously, if you're taking care of someone who is sick, wear a mask. I've heard this. I've posted it, and I said, you don't have to wear CDC guidelines. You don't have to wear a mask if you're healthy. And then I hear, but doctors wear masks. Well,
that's to protect you from them.
Duh.
Yeah.
Doctors are protecting you because if you're go to see the doctor, you have something wrong with you, and he doesn't want to give his germs to you because your immune system's already screwed up anyway. So and someone actually said something about why do they wear them during surgery? I'm like, are you? I'll try to hold this for the next one, but because he doesn't want to kill you. He doesn't want to kill his patient with because he's cut open or she's cut open. You don't want them like slobbering into the open wound. That's why a surgeon wears a mask, people. Okay, anyway.
I would be interested to find out what their recommendations are if you're sick. If you should wear the mask if you're sick to keep you from coughing.
I just read that today, and I don't remember exactly what it said. But yeah, you should wear a mask if you have someone in the room with you. If you're in a room by yourself, you don't have to do it. But if someone's coming in to take care of you, you should don a mask, and it should be, back to the trip. I saw people wearing their masks. I saw one woman wearing it upside down. It was one of these N95s that had the filter thing in it.
Yeah. Yeah, I know what you're talking about.
Upside down. It didn't fit her face at all. I mean, the part that goes under your chin was on her nose, and it was. It's no point in wearing it, ma'am. Absolutely. And another family, they actually were behind us. It was a bunch of teenagers. Mom dropped them off at the airport, and they all had masks, and they kept taking them off, on and off, on and off, on and off, and touching everything and touching the mask. No point to wear them then. if you're not washing your hands every time you touch the mask, or before you touch the mask, and all that. No point. So people are like, if you wear the mask, it'll help. Well, again, wash your hands, keep your workstation clean. If someone does sneeze on you or something like that, go wash up immediately. Not everybody's going to get this thing. You could be in a room of 20 people and walk in there and be infected and give it to 4 people out of the 20. Not everybody's gonna be affected by this immediately. It's like shooting craps, right?
Well, this is a good.
It's not 100% if you walk into a room with someone with this disease that you're going to get it.
Well, this is a good transition into you and I were talking before the podcast that neither of us really thought that the disease was going to be as much of a problem as the economic fallout from this thing.
Yeah.
Because we got some stuff to report on that too, obviously.
That's my concern.
Yes.
And that's been my concern since about day 2 of this thing, is that economically we're going to be affected more than myself. I foresee myself not getting sick. I foresee everybody I know not getting sick. It's just the odds of living. It's just you have to first you have to come in contact with the person who has it. Then your immune system has to be at a point where it's affected by it, and then even if you do get sick, you might just get a little tiny bit affected by it, and then it's gone.
Well, I've seen
you may not get full blown, and that's why it's getting the older people more, is because they have weakened immune systems and they have issues already. And if you're a healthy adult, chances are you might get a little sick and then it's going to be gone. Obviously, let's see, 93,000 confirmed. Now, this is numbers from China. Obviously, this is, again, they're probably lying on it. 50,000 have recovered.
Right.
So, and it's killing 3.4%.
3.4% right now. That's confirmed.
That's a high percentage. That's much more than the average flu every year.
And that's from the World Health Organization, again, just to recap that.
Yeah.
That's not hearsay.
But it's only 3.4%. It's not killing 99% of people. It's not killing 50% of it. It's not killing 10% of the general population. Now, as you get, we saw the numbers. I sent those numbers to you the other day, where it broke down by ages. Now, if you're, 80 and above, the mortality rate is like 53%,
yes,
something like that. And that's because of the
underlying health issues,
underlying health of the individual who are getting it. So, but the average person, it's 3.4.
Well, there was an article on the Washington Post, and that's one of my talking points, and it says infectious disease experts have agreed that the coronavirus could create a pandemic on similar scale to the 1957 influenza outbreak, which killed like 250,000 people. I think it was like 70,000 in the U.S. If you think about that, how many people were infected? I don't have that number, but that is not that many people considering the worldwide scale that this disease has already exploded in. You know what I mean?
Mm-hmm.
I mean, 250,000 people is a lot of people, and I'm not trying to downplay that, but out of how many billion people in the world? I'm pretty sure that the flu got more than that.
In 1957, there was probably, 2 to 3 billion people?
Let's say 3. I was going to say 3, but okay.
I don't have my phone. I don't
either. I can't have it near the podcast gear, unfortunately.
Yeah, I can maybe turn it on see now that we're hooked up. But, yeah, I mean, we always say, we talk numbers, and it sounds horrible when you're like, it's only, but it is only.
Right.
And the Spanish flu here in this country, we always hear about it. We've heard about it all our lives. The Spanish flu, the Spanish flu, the Spanish flu. When you look at it, in the U.S., it affected a crap ton of people. Now, at the time that it happened, the U.S. population was just over 100 million, like 110 million, I believe. And we have like 330 million now. It killed 0.6%, so a little over 0.5% of the population. Now, that's a lot.
That's a lot. Yeah.
That's a lot of people, especially if you're one of them that affected by it. If your family was affected, it wiped out like whole villages and
whole communities
in Alaska and stuff like that. And if you're personally affected, it's a lot, but it's only 0.6% of the population, and it sounds horrible to say, but it's not that many.
I think over the next week is when we're going to get a handle on how quick this is going to spread in the United States. Washington, obviously, is the epicenter for the United States right now.
Washington and California.
I don't have California's numbers. I wish I would have printed that out.
For some reason, I can't scroll down on this.
But
on this page here.
I think today is Tuesday the 3rd. So I think by probably Saturday we'll have a good feeling on what's going on, because I think it's 14 days they said is generally how long it's taken for it to really show itself.
It's bebopped around between. I've seen as little as 6 days, and I've seen up to 24 days.
Right.
So I'm not sure what they're. I've kind of pulled myself away from it because it's so much crap has been going on in the last 2 weeks. It's getting nauseating to read, and it doesn't really change.
Well, one of the things I do is I keep up on foreign news. I've listened to Radio Taiwan and Korea. Yeah, Radio Taiwan, Korea. Everybody agrees China's, quite frankly, full of shit. I don't know how else to put that in a nice way. Romania and Holland were reporting, I believe it was midweek last week, that they had cases, and that they were 13 or 14 days from when they had been exposed. So you could have it right now and you don't know it, Yeah.
Oh, yeah. Yeah. Romania's got 4, it says.
Yeah. They jumped on that pretty quick.
Let's see in Holland.
It was Holland or Norway. I don't know. I had some Dutch station. I don't know.
I got Denmark here.
Denmark, there you go.
10.
Czechoslovakia was checking in on a couple of reports midweek last week. I think they were just testing.
Set up.
You'd be surprised what you can learn real quick. Especially when you listen, in this case, to Radio Taiwan and Radio Japan. That was very telling, because they were pretty much calling China a bunch of liars right over the radio. And I would imagine, now China obviously has a pretty good lockdown on their information, but I would imagine just like anywhere you've got pirate radio stations, and you have Korea and Taiwan and Japan within range of picking up those broadcasts, so
definitely.
They probably have a little better idea of what's going on than we would in China. So
let's see, I'm looking at number 1957 pandemic H2N2 virus.
Yeah.
Hong Kong. This is 1.1 million worldwide and 116,000 in the United States. U.S. population 1957. Let's look that up. See, people, Google.
Yeah.
And actually, I'm not even using Google. I use DuckDuckGo because they don't track what you do like Google does. When you want to find out information, there's a thing that you have in front of you generally. Most of us have cell phones that are smartphones now, or a tablet or a computer, if you want to go old school. There's these search engines. They work terrifically. Now,
go to a reliable news source.
You have to state the question in a certain way as to not get biased information.
Which I've heard a lot of biased information. So
yes. So please be careful when you Google something or DuckDuckGo something. I'm going to stop saying Google. DuckDuckGo something to phrase it correctly. Otherwise, you're going to end up with bullshit.
And there's a lot of bullshit. I mean, I'm not going to call out any radio stations or broadcasters or anything, but I had one that was calling this the end of the world.
Oh, God.
There was one specific person that likes to sell his products off of his website, pretty much telling everybody that the what is the word that he uses? The New World Order is created this. So yeah, you guys know where I'm going. I'm not going to say names or anything for fear of legal reasons, but go to reliable news sources. I mean, these people are not going to generally bullshit you about this, and make your own opinion. Everybody's entitled to them. Everybody has one. If you think it's time, if you think it's time to go in your bunker, by all means, go in your freaking bunker and hunker down for 2 weeks. If you can afford to do that, and you feel that that's what's best for you and your family, then we're not trying to talk you out of it.
Okay, the U.S. population in 1957 was 177 million, and what did I say? 126,000 people died. So that's less than 1%.
Yeah.
So 0.8%, roughly.
And that was a news headline generated to get clicks, and as you can see, it's not as bad as what we're dealing with. So you know what I mean?
Yeah. So, and that's 0.8%. That's 3.4 is 4 times that. So plus. So potentially, if you want to take that number, 126 times that by 4. That's 100 million or 500,000 people. If you want to go that route, that way. So, but yeah. Geez, there was a guy I saw a message. They were pulling their kids from school for the remainder of the year, and they were in a state that didn't even have any cases yet.
Well, we've talked about it, and I've struggled with what to do about my kids. Because let's be honest, school's a germ factory to begin with. I can't tell you how many times my kids come home and got me sick. I mean, geez. I think if this takes off any further, you're going to wind up seeing some school closures, especially out in the areas like Washington and California. I wouldn't be surprised if you see that next week.
Yeah. I saw that the other day. Someone had tweeted something about their friend was a firefighter in Northern California, and Northern California was going to be quarantined on Sunday. No one in and out of Northern California.
Mm-hmm.
For one thing, that's not possible. And another thing,
build a wall.
It didn't happen because it's Tuesday and it hasn't happened yet. So please don't listen to everything you see on Twitter, on Instagram, on whatever the hell you have. Facebook, what's the Snapchat, any of that, whatever.
Well, I saw people freaking out in a group on Facebook, one of the prepping groups, because the CDC has announced that President Trump is ready to enact some act, and I don't have it written down in front of me, so excuse me, but like they're not the CDC, it was FEMA. So of course, the freaking FEMA conspiracies came out of the freaking woodwork. Well, if you actually read what it was, is it just allocates more funds for FEMA to help if there is a pandemic, and he hasn't done this yet, and it's just on the table and it's an option.
Yep.
But all of a sudden we got UN trucks rolling in and FEMA death camps again. So it's like, what the shit is going on with you people? I mean,
yeah. FEMA who can't get who can't get water to a hurricane zone is going to somehow round up people and
take you to Walmart.
Whatever.
Yeah, take you to fenced-in places in Walmart.
Yeah, it's just that's for the next podcast.
Inoculate.
That one's gonna be fun. If anybody wants to hear new swear words, listen to the Rant podcast.
That's
It'll
coming.
be next.
Yeah, that's coming.
It's coming up. Hopefully, we can do that tonight.
Well, we're 30 and a half minutes into this one. Okay. I still have quite a bit that I'd like to touch on. I don't know how.
Go ahead and get on it.
Well, the economic thing. This is real. This is more real in my eyes than us all coming down with coronavirus and dying. Right now, today, the stocks plummeted 800 points again. Yesterday, they did recover. China announced, is this a coincidence? No. In my eyes, it's not. But China announces they're closing one of their hospitals. Everybody's getting better. Dow jumps back up. Today, South Korea comes out with their numbers. Dow jumps back down again. I don't know.
And they decreased the prime rate today.
Prime rate.
By a whole half. Was it quarter or half?
I'm not sure.
Half.
I'm not sure.
I think it was a half. So
India has announced this evening that it is restricting all drug exports due to a shortage of ingredients from China. Now, put that in perspective. A quarter of the drugs in the United States comes from India. India is pretty much the leading supplier of generic drugs in the world. Okay, that's a real thing. This is why we prep. That could really be bad for a lot of people. You could see prices skyrocketing. You could see shortages. You could see, real issues off of that. So hopefully you guys got
shitty fake drugs from some guy's basement.
Yeah, meth in a kitchen sink. You know what I'm saying? So that's a real thing. I mean, the economic impacts. If you think about it, let's just say, for instance, and Pete and I and a couple of the other people we talk in chat a lot. Let's say, for instance, one Walmart distribution center closes because they've had an outbreak. Well, that's a real possibility. That shuts down a tri-state area. Yeah. So buckle up is all I got to say. That the real impacts are the ones that people aren't even talking about.
Yeah, not too much. Yeah, just being able to get stuff.
Yeah.
And pissing people off. If Karen can't go down and get her freaking coffee in the morning, she's going to be a raggedy bitch. And it's
yeah, exactly. I mean,
sorry, Karens. For all the Karens who aren't Karen in parentheses, please forgive me. But we've talked about it before. It's one of the points I make when people bring up martial law, but there's just too much stuff that we rely on to, even for one aspect of the country to. Let's go with the martial law thing, okay? Let's say they have, you can't be out after 10 o'clock or whatever, But how do you ship everything if you can't be on the roads?
Right.
After? When I used to work in a grocery store, it was the mid-management level type stuff. At the time, and this was 8-9 years ago, the average item on the store shelf traveled 1,800 miles to get there. I remember one time we got. It was so stupid. It didn't last very long. It was like Fruit Loops that they stuck together and made a straw out of it, right? Or it was really gay. And I saw this thing and I was like, "Oh, sorry, homosexual people out there. I didn't mean that." But anyway, it's just terms. We've used them all our lives. Sorry. Product of Italy. These were made in Italy. It was like Fruit Loops that they stuck together into a straw form, and you could drink your milk out of your cereal bowl. And it was made in Italy and shipped all the way over here. We are such a spoiled civilization. It's unbelievable.
Well, I've seen something where we manufacture something here, ship it to China to have them assemble it, and then China sends it back again. I mean, what the?
Oh, we're doing that with chicken.
Yeah. Oh, yeah.
We're shipping our. we're shipping our dead chickens over there, and then they're processing them and then shipping them back.
Yeah, that smells good at the end
That
of the day.
makes no sense. That's rant. That's another rant one. What's wrong with this country?
I don't think we have enough recording
So,
space on the
yeah,
computer for that.
I may get a knock on the door. But we're so connected now. You know, they call it the global economy, but don't even think globally right now. Think they have these recalls of meat from some factory in California where they have to recall,
Yeah, for a cola or something.
you know,
yeah.
200,000 pounds of ground beef, and it's like it was shipped to 15 states. We're affected by all that stuff. Imagine if one of those meat packing plants had to shut down. Imagine what it would do to the
Yeah.
price of beef.
No doubt. Here on the Eastern Shore, I mean, we're a huge chicken producer. That
Chicken.
is-
We have turkeys around
yeah,
us.
we're a huge chicken producer, and I mean, you have Mount Air chicken, you have Purdue chicken, Allen, which is what the hell is the name of that brand? Tyson. That's all here, and
Yeah.
if one of those plants went down, I mean, that could be a huge impact on a lot of people quickly. You know what I mean? And let's be honest, chicken is the new beef. It's cheap. It's easy.
It's cheap.
Yeah.
And, we have turkey around here. We grow a lot of potatoes around here,
Right.
and also sugar beets. We have a Crystal Sugar plant in Moorhead, Minnesota. That I think Crystal Sugar is sold everywhere in the country.
I actually
At least in
haven't
the
seen it
Midwest.
here. Yeah, I haven't seen it here. We're Domino Sugar here because that's here.
Oh, okay, Domino, yeah.
That's here in Maryland.
But at least a huge chunk of the Midwest is all Crystal Sugar. And if that plant shut down, now granted they have more plants, but if you had to shift whatever percentage of your production to another plant, you can't just do that overnight. You know, and then what if that plant? So yeah, economically and supply wise, this could get bad, and it may not even be that many people that get sick.
Right.
It's just one or two people. I read a couple weeks ago there was car plants in South Korea and other places that had to shut down because they couldn't get one part from China.
Right.
So
Yeah, things can
this
come to a
could be,
crawl quick.
and
yeah.
it could be a mess for not just the next 2 months. It could be a mess for a year, if not longer, depending on how long it takes this thing to either burn itself out or they get a vaccine that actually works and actually get it to the general
I've seen a couple
population.
things that they're possibly fast tracking a vaccine right now, but I'm not gonna. I'm not.
I've seen from late this summer
Yeah.
to a year and a half from now. So
I'm not so stressed about getting the virus. I mean, obviously, I have older parents, in-laws that are older parents. My kids kind of concerned about that because of the school thing, but I think and I hope that everybody would be okay for the most part. But right now, everybody's feeding into the fear.
Oh, God,
You know, they are feeding into the fear, and the fear is causing the panic buying. And you know, I saw something where Twitter's CEO had just came out and told he doesn't want his employee. They don't want their employees coming into work. They want them working from home. Well, okay, you don't have. Okay, you know that's one great example right there of feeding into the worry and the fear. What happens if that happens at
You
Amazon?
think you're
or
doing the right
Walmart?
thing,
Yeah.
but you just panicked 20,000 people that read it on
Exactly.
Twitter.
Yeah. So I mean,
And it's great they can work from home because working from home is freaking fantastic. But yeah, it's also
well,
you
the
know,
problem
of
is,
course,
is
you're damned if you do, you're damned if you don't.
if let's be honest, if most people do get sick, they're still going to go to work unless they're freaking dying because they can't afford to take off. You know what I mean?
Yeah.
And unfortunately, the United States is not mandated that we have any sick days and all that. So and lots of people live paycheck to paycheck, and you know, things could actually be worse in some cases here because of that. With the actual getting sick, I'm not not necessarily the dying and deaths, but like. The panic of mom and pop grocery. I think you said you worked for a smaller grocery chain, so
Yep.
you think of that grocery chain and they have 4 employees that wind up getting sick. They shut down. Well, that little grocery store just pushed all of their supply and demand over to another store, which makes that store take a bigger hit, which makes that next store take a bigger hit. And, this shit could get rolling downhill like a snowball real quick,
Yep. So, the key, wash your damn hands.
Wash your damn hands. And you could do more.
Tell everybody to wash their damn hands. Look over at a coworker in the cubicle, roll your chair back, lean back, and go, "Hey, Phil, wash your damn hands."
Yeah, exactly.
Just,
And I mean, you could limit some of your public exposure. We have not done that yet. We're talking about, there's certain things that we like to do where there are generally a lot of people around. And we may cut down on that a little bit. There's things you can do, though. Just like you said, wash your damn hands. We went to the Dollar Tree. They have hand sanitizer. Everybody's complaining there's no hand sanitizer. The freaking Dollar Tree has rows of it. They had these little things that are like travel versions, and they had wipes, and
buy a thing of baby wipes.
Yeah,
I mean, or buy it.
There's a lot you can do, and
if you want to, and you don't have to buy 4 bottles of bleach.
No,
you dilute the bleach with water.
Yeah, I think it's 50-50 is this for concentrated bleach. Now I do know for a fact that at the Dollar Tree and stuff like that, some of that bleach that they sell is already diluted with water. So make sure we're talking about something that's not diluted, pre-diluted.
So, and remember, and also bleach does not last forever. Bleach only lasts roughly about a year,
right?
And it's starting to break down before that year is up. So, don't go and buy 5 bottles of bleach unless you have like a 20,000 square foot home,
right?
But then you're having someone else buy it for you if you get a 20,000 square foot house. Jeeves, go buy some bleach.
Mr. Belvedere.
Yeah. So you don't have to go nuts and buy a cart full of bleach. Just one nice big bottle, and you find a spray bottle home and dilute it and do your mix, and do your stuff. It's
and one thing before
plain and simple hygiene. It's
one thing before we wrap up. The damn thing that's going around showing the picture of coronavirus on a Lysol bottle from 2 years ago. Please stop sharing that shit.
Yeah.
Please,
yes.
I beg you to stop sharing that.
Coronavirus is a family of viruses,
much like the flu or the cold.
There are, was it 8 that are known?
I believe so.
There are 8 known coronaviruses.
This is called CVON or whatever it's called. So 9.
Yeah.
So yeah, it would make sense.
So and this one, the current one that everybody's freaking out about is the COVID-19. 19 means it was started in 2019. That's what I take from it. So yeah, and the Simpsons thing and that book.
Yeah.
Whatever. Everybody's like, oh my God, look at this. It's Wuhan. Well, it was 2 lines out of the book, and they choose to ignore the other 8 lines saying how the actual virus works. But just because it happened, I found a picture of Japanese soldiers walking through Wuhan, China in 1941 or wherever, 1942. Does that mean the Japanese started it? No, it doesn't. It was just, it's a city in China. It's I don't even know if this author's still alive. I wish they'd find him. I don't know. Was it Dean Koontz?
Koontz, I think it was, yeah.
I don't know if he's alive or not, but ask him why you picked that time. He looked at China and threw a dart at it, probably a map of China, and threw a dart and picked up Wuhan. Who knows? But yeah, forget the conspiracies, forget the FEMA thing, forget it's not chemtrails. Yeah. This would be a good way to segue into the other rant one if you have time. But
yeah.
So anyway, wash your damn hands. Tell your neighbors to wash their hands. Don't punch them in the throat if they don't. But if you work in an office, talk to your office manager or talk to your boss about, hey, let's make sure everybody's washing their hands and cleaning their workstation.
Right.
Why don't we, for 20 minutes in the morning, why doesn't everybody just clean their workstation up? And let's, but then, so do your part. Don't get nuts. Take it easy and chill. We'll get through this. It's fine, dandy.
Yeah, it seemed to me the biggest thing that I keep seeing is everybody's worried about the virus and nobody's seeing the forest through the trees. You know what I mean, with the economic issues. That's a real. That's the shit that'll keep you up at night right there, not the virus. You know what I mean?
Yeah. Oh yeah. It's the truck stop rolling and there's no food on the shelf. For a week or something, and it's just a lot of people don't have food for a week.
Yeah.
So. And I know you like your freeze-dried stuff.
Yes, I do.
But you don't. If you're thinking of buying extra food, you do not have to get freeze-dried stuff. Freeze-dried stuff is like for long-term storage for 25 years. If you think you're going to need to have food 6 months from now, guess what? The can of corn that is on the shelf at the grocery store is good for like 2.5 years, minimally. Probably a couple more years after.
Yeah, I was going to say, you and I both know you can get a little... as long as your cans aren't burst, open, dented, eat the stuff, Yeah.
Tuna lasts for like 5 years. Pink salmon...
I just found that out. I never realized
that.
Yeah, I never knew that. We got some kind of little tuna snacks just to have with us, and she happened to look down at the expiration date, and she's like, this shit's good for 2 years. I'm like, get out of here. I didn't know that.
And that's a short one. That must be because of the crackers or something.
Yeah, exactly.
I think tuna is like 5 years. Buy the normal food that you buy. Power's not going to get cut. I know people that work in the power industry. They are prepared for stuff like this. They have places for their employees to sleep at their generating plants and at their control rooms. They have food. They have emergency rations there for their employees. They would obviously go and get more, and they also have military backup. They'll come and protect them if there happens to be some reason to need protection, or they will come there and set up some kind of supply chain, because if it's one thing the government doesn't want is the power to go out, because then it's total freaking anarchy, because people can't get their cable TV to work, and you don't want that to happen. So the power is going to be on for as long as it can. If this thing jumps to 99% death rate, the power is still going to be on for a long, long time.
Right.
So. And that includes water, and that includes natural gas. Maybe not gas at your gas station, because maybe some plant had needed to shut down because, So think about that too. Maybe keep your gas tanks full on
keep
your cars.
Cash.
And
keep
maybe
cash.
Go buy a couple 5-gallon gas cans and fill them up, and then you have extra gas at home. And you're not going to be traveling very far anyway, because if stuff gets closed down, you're not going to don't have any place to go. But just get regular food. You don't have to panic buy, a pallet of crap at Costco that lasts 25 years. One thing, your body probably won't like it, and you'll be crapping your brains out the entire time, or not crapping at all. One or the other. So just buy your normal. If your normal everyday food is frozen pizzas and TV dinners, buy some frozen pizzas and TV dinners. It doesn't matter, as long as you have something to eat. So if your normal beverage is Diet Pepsi, go buy a couple cases of Diet Pepsi. There's a meme I saw, something about for hurricanes. Don't kid me. It was something like, don't kid me, Karen. Sorry, Karen again. Don't kid me, Karen. You don't need to buy no water for the hurricane. You drink 4 cans of Mountain Dew a day, or 4 bottles of Mountain Dew a day. That hit me hard, because I used to drink 4 cans of Mountain Dew. So, just buy what you normally eat. If you eat out a lot, then you may have to think differently. But you don't have to buy special food for this potential pandemic. It's not a pandemic yet, not in this country.
What classifies a pandemic? I don't even know the answer to that.
Pandemic means, well, it's close to being because of the numbers in South Korea and Italy and Iran. If the others start to get up there, it's between an epidemic and a pandemic. Epidemic is just a large outbreak of a certain disease in one area. A pandemic means it has crossed borders.
Gotcha.
But it still has to be large numbers. Now, I don't know what they classify as large numbers. I don't know the specifics of that, if there's a certain percentage. And like I said, the only countries that are showing, there's only 3 other countries that are showing over 1,000 people. Maybe once a couple more countries pop over 1,000, maybe they'll categorize it as pandemic. I don't know. Pandemic has nothing to do with lethality, so it could not kill anybody. It just makes lots of people sick, or it could kill 99% of people. It doesn't have to be a certain level of that kills people. It's just a disease that spreads over borders. That's what a pandemic is. It's got nothing to do with how many people die. It does just have who gets sick and where they are. So,
hey Pete.
Go check out the CDC website. Go check out your state health department website. Yes. Go check out the WHO website. Not the WHO like the band, but WHO, World Health Organization. Check out FEMA. Oh crap! I just saw some. If you're a medical professional, which I'm sorry if you're listening to us, if you're a medical professional.
Yeah, right.
There is, I just saw it, and of course I didn't keep it. I can look it up real quick. They are offering a online class somewhere for people to be able to I lost my words now. To help, it's through Baylor College of Medicine, coronavirus.baylorcme.org. It's a coronavirus SARS-CoV-2 now, whatever, the agent responsible for coronavirus disease. This is a online class for participants to identify patients who should be evaluated as patients under the investigation for SARS-CoV-2. And so it's for medical professionals. The target audience is physicians, advanced professionals, fellows, residents, nurses, and other health professionals. It's actually an accredited course through Baylor College of Medicine. So check that out. I'm not a medical professional, so I'm not going to do it. But that was posted on Medical Survivalist. That's a Facebook page run by a bunch of guys who are in the medical field, mostly ex-military or in current military, and then now they also work still in hospitals and whatnot. So, Baylor College of Medicine, coronavirus.baylorcme.org for any medical professionals who want to find out how to better identify potential coronavirus patients. So,
Pete,
we're
going to have to wrap. Yeah, I was going to say, I got a lightning storm coming in and out. Last thing I want to have happen is lose 54 minutes of you and I shooting shit over coronavirus because we lose power. So,
okay, we don't want to lose that.
Now,
I guess we'll have to do the rant video.
Well, we can try that. I just don't want to lose this one. So,
okay, yeah, let's wrap it up. So, take it easy. Don't freak out. Be calm, patient. Wash your hands. Tell everybody else to wash your hands, and just we'll get through it. And just watch official stuff, not some knee-jerk YouTube video, dude. So.
I think if this takes off anymore, we'll start doing a little more with it. Also, I was thinking about talking to you after the podcast, but if this gets to the point where we're really having issues, we can also keep up to date on the podcast a little better. I think too. even if it's just
and
a 5 minute.
I contemplate. I said I wouldn't do it again. I contemplated I
Yeah.
would reopen 21st Century Prepper. I don't know if I want to do that though. That's too much of a pain in the ass. So that's it.
Yep. Wash your damn hands.
Wash your damn hands. Keep calm. Thanks, everybody.
I let you in, but it won't do.